Okay, we do a quick summary of the gout medicines, please. Very important area is gout, right? Mostly you can prescribe in tincture to bring down the uric acid levels, so it will take care of the pain, it will bring down the uric acid levels. Also, if there are a lot of symptoms to deal with, you can use potency, right? The first one I shared with you was Ammon phos. You remember Ammon phos is more for the advanced stages of gout, right? You see the picture, more advanced stages of gout with a lot of nodosities in the joints, nodes in the joints, with aggravation from cold air. That's important. Why cold air aggravation is important? Ammonium group of medicines have got that cold air aggravation. You have that in Ammon phos, you have that in Ammon dorema. I shared with you dorema was a medicine for breathing difficulty, bronchitis in winter. In old age, yes. Bronchitis in winter, in old age. So like dorema has got bronchitic symptoms developing in winter, similarly Ammon phos has got like joint symptoms developing in cold air and cold weather, right? So a lot of nodosities in the joints, they're very tender, as you can see in this picture. Advanced stages of gout, you can help with Ammon phos. 3x, 6x triturations to bring down the uric acid level, to take care of the nodes as well. Really, really useful medicine for gouts and tophi with advanced stages in chronic cases of gout with cold air aggravation. I shared with you benzoic acid, 3 things for benzoic acid. Very offensive urine. It is Nash's trio of offensive urine: sepia, nitric acid, benzoic acid, right? Offensive urine, combine that with cut, cracking in the joints, worse from movement, right? Cracking in the joints, worse from movement. That's important. And also remember, third thing I missed out on that for benzoic acid. Whenever you're prescribing benzoic acid to someone, don't ask them to take alcohol. Alcohol is inimical to benzoic acid. If you give alcohol to a benzoic acid, if the patient is on benzoic acid, you give them alcohol, that hinders the action of benzoic acid. May produce an aggravation. Okay, so alcohol may aggravate. So it's written in Allen's incompatible with wine. You're with me? I shared with you Berberis. You remember Berberis, three areas where Berberis is prescribed: renal stones, gallstones, gout, right? In all the three, what is common? Migratory pains. In all the three, what is common? Standing aggravation like sulfur. Very important, I shared that with you in boric A. Standing brings on or increases the urinary complaints. So standing aggravation is very important for your Berberis, right? And it's a psychotic medicine, so lithic diathesis. So tendency to stones, renal stones, gallstones, right? With the migratory pains. Which side especially? Left side. So left is mostly affected for Berberis. Very important gout medicine. You can use in tincture again to bring down the uric acid level, or you can use 30C, 200C to bring down the pains as well. I shared with the colchicum. No other medicine in the entire Metromedica is as sensitive to touch in that great toe as your colchicum. That's why I shared with you, they cannot travel in a public conveyance, they cannot travel in a bus, because whenever you touch that toe, they scream with pain. That kind of sensitiveness, right? So great toe, very, very sensitive with gout. I shared with you no other medicine again in the entire Metromedica is so much sensitive to the smell of fish, right? Very, very sensitive to the smell of fish. So again, nausea from odor of fish, your colchicum is the leading medicine. So wonderful for morning sickness as well. And I shared with you number 3 for colchicum, if you remember, is mucus colitis, so IBS, resulting from misdeed of others. So you saw your boss, your Naxomica boss misbehaving with someone, your Naxomica boss being very dictatorial, you cannot express it, you're keeping it inside, you're bottling it up. You started with Staphylococcus aureus, but Staphylococcus aureus didn't produce any result. You went to colchicum because of the gastric preponderance, because of the mucousy stool which recurs every autumn, and there your colchicum will come to the rescue. So where Staphylococcus aureus doesn't work, colchicum will work, especially if there is bottling up of emotions on seeing some misbehavior, on seeing some disrespect, and your colchicum will come to the rescue. Colchicum mostly in potency, 30C, 200C is a good choice of potency for colchicum. I shared with the Formica rufa, prepared from crushed ants, where remember symptoms like magphos and your magphos is not working. I shared with you Formica is a medicine for today's modalities, 21st century modalities. Every other household where there is osteoarthritis, they will tell you, I have tried a kneecap. Kneecap makes me better by pressure. Every other household will tell you, I tried hot oil, I have tried hot flannel, that makes me better by hot application. And again, every other household will tell you, I have tried some ointments to apply, massage, rubbing makes me better by rubbing. So when you have the three common modalities for the 21st century, better by rubbing, better by pressure, better by heat, the three is for Formica rufa. Which sided? Right sided, like magphos. Whereas magphos was more for sciatica, Formica is more for joints. Right? Magphos was more neuralgic, here it's more rheumatic. You with me? More rheumatic. Whereas magphos was more neuralgic. And gout as well, rheumatic and gout, both. Right sided like magphos. But three modalities never forget, please, for your Formica. Better by heat, better by rubbing, better by pressure. 30C, 200C works well for Formica. I shared with you lithium carb. What was lithium carb? Very close to lycopodium. Why lycopodium? Because right-sided, uric acid diathesis. Right eye is affected. You remember I shared with you lithium carb, right half they cannot see. Hemiopia. And like lycopodium, right kidney is affected. So features like lycopodium. But what is the associated feature? Heart. You don't have heart involved in lycopodium to that extent. So heart symptoms better by? Better by? Urination. Sodic modality. Better by? Urination in case of lithium carb. Again, when lycopodium comes to a standstill, especially with joints, think of lithium carb. And also I shared with you lithium carb is also useful for rheumatic fever, where you have joints and heart combined. Joint symptoms is better by heat, whereas heart is better by urination. Right? That was lithium carb. Lithium carb also 30C, 200C works best. And which was the last one? Urtica urens. I pointed out in that 4 areas I shared with you. Number one was urticaria from shellfish or drugs resulting in like an anaphylactic reaction, so angioedema. I shared with you burns, second degree where you have more vesicles. First degree was cantharis with a lot of redness and rawness and burning. And third degree is carbolic acid with a lot of ulceration. Right? Third I shared with you agalactia, so deficient milk secretion with a lot of allergies. Right? Agalactia with a lot of allergies. And fourth, I shared with you gout. If you have a history of allergies, you can prescribe Urtica urens. For all these three, you prescribe in 30C, 200C. For gout, you can prescribe in tincture to bring down the uric acid levels. Okay? So that's important for your Urtica urens. Top 6-7 medicines I shared with you for gout, and I hope that helps. Okay?